people with Alzheimer's.
Alzheimer's, yep. The Alzheimer's, that's the biggest, by far, the fastest growing segment of
I know it is.
Hospice care. Cancer is
Scary.
actually a minority of the patients that we
Really?
care for. Yep. It used to be all cancer. Now it's less than 50%.
Wow.
And as the population advances in years,
Right.
and people are living into their 70s and 80s and 90s, Alzheimer's and other types of dementia, which Alzheimer's is a fatal illness.
Yeah. I know.
They find themselves on hospice, and they will develop symptoms that are often predictable, and we can help control those symptoms.
Right.
But sadly, it's that set of patients where the families need the most support.
Oh, I know.
Because
I can imagine. Yeah.
the patient may lack insight as
Right.
to what's going
That's
on,
right.
but the family still has to watch out for the person
Right.
they love and make sure they don't get hurt and that their needs are met.
Right.
And so those are families that need a lot of help.
See, I think that, I never knew that Alzheimer's patients would go to hospice.
They do.
And I think that it's great because a lot of them end up in places that you wouldn't want your parents to end up in.
Mm-hmm.
And I mean, I've been there because I used to volunteer and go to nursing homes and places like that.
Mm-hmm.
And I used to go there at different times so that I'd know what was really going on at nursing homes, and I found out to my dismay. But so I think that having that opportunity, it's not somebody, though, that's going to have Alzheimer's for 5 years. It's somebody that's near the end of Alzheimer's.
Near the end, and it's
Yep.
usually it's very, very variable, but around 8 years into the diagnosis, their symptoms have reached we have a scoring system
Sure.
that's used in medicine, and if they have severe advanced Alzheimer's, and that has a number of 7A, and
Right.
that at that point they're eligible for hospice care, and they'll almost always be symptomatic with confusion or agitation.
Sure.
Or day-night reversal, difficulty sleeping, and
Boy,
lots
that's
of
tough.
judgment or insight. And
Yeah.
there are lots of medications and lots of techniques that we can use to
Sure.
help the families cope and help the patient to be more comfortable.